namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And if you have not gone to hotzepodcast.com, then you need to do that. Download all of our podcasts. That's HOTZE podcast.com, because, of course, everybody needs a health coach. Now, topic for this show. Oh, my goodness. Feeling so tired. Feeling tired all the time. What could it possibly be? Could it be chronic fatigue? A lot of people are diagnosed with that these days. It's a popular term. Dr. Hotze, maybe you could explain a little bit more about chronic fatigue.
Well,
syndrome.
obviously, when you hear the terminology chronic fatigue syndrome, if you have a lick of sense, you know that's not a diagnosis. That's a description of the problem. If a person has chronic fatigue syndrome, there's a cause for the chronic fatigue syndrome. Could be caused by chronic infections. Epstein parvovirus could be caused by Lyme's disease. But more commonly, there are two main things that cause a person to have chronic fatigue. It's a common complaint we see here at the Hotze Health and Wellness Center when our guests come in. One of the most common complaints we have is a decline in their overall energy level. They feel fatigued and they feel tired. Mm-hmm. You know, I always like to ask people to rate your energy level on a scale of 0 to 10. 10 being brimming with energy, best you ever felt, 0, no energy. I like people to rate themselves. And they'll go, well, I'm just a 5, or I'm a 6, or I'm a 4. We want people to be at a 10. Everybody should be operating at full energy. You ought to be full of energy, brimming with energy, enthusiastic, optimistic, and have vim and vigor, just ready to get up out of the bed and get things done during the day. And you shouldn't be collapsing in the afternoon tired, and you shouldn't collapse when you go home. You ought to have plenty of energy, and that has to do with energy production within the cells of your body. That's important. So this whole concept of chronic fatigue syndrome, which the Center for Disease Control even has a criteria for people to be diagnosed with chronic fatigue syndrome. They have to have chronic debilitating fatigue that has occurred for over 6 months. They have unrefreshing sleep. They have joint and muscle aches and pains. They get swelling and redness in their joints. They may have recurrent headaches is a common problem, or if they have recurrent sore throats or tenderness in their lymph nodes in their neck. 4 out of 8 of these symptoms is considered chronic for lasting 6 months or more, meets the criteria for the Center for Disease Control, a government agency, to say a person has chronic fatigue syndrome. It still doesn't give them a diagnosis. So if they cluster 4 symptoms together and say, if you have these 4 symptoms, we're going to call it chronic fatigue syndrome. But all it is a cluster of 4 symptoms. It doesn't try to recognize or obtain the underlying cause of the problem. So chronic fatigue syndrome is simply a label that a doctor puts on somebody who has been tired and fatigued for over 6 months, and they don't have refreshing sleep. They have joint and muscle aches and pains. They hurt all over, and they don't think well. What does that sound like? What classical problem does that sound like?
Maybe low thyroid?
Hypothyroidism. It's the classical features of low thyroid. Oh, but they don't have low thyroid, the conventional doctor says, because we did a blood test and the blood test falls within the normal range, as do 95% of all the thyroid blood tests always fall in the normal range, because that's how the lab defines what's normal, wherever 95% of the people fall. A person's blood test does not tell you a person's symptoms and how they feel. Oh, but the doctors say if you fall within the range, well, you've got now chronic fatigue syndrome. It's not due to thyroid. We don't know what's causing it, but we know how to treat it. And they'll give you, what do they give you? An antidepressant. They'll give you Lyrica. They'll give you some other Cymbalta or some other antidepressant, as if the reason you have chronic fatigue syndrome is low in some pharmaceutical drug, which is crazy. So the symptoms of hypothyroidism are very simple. One sum or all of these symptoms. One is fatigue. You're tired. You don't have the energy you used to have. You fade in the afternoon. You go to sleep. You don't feel rested in the morning. You're tired all the time. You have maybe difficulty with weight. That's a very common problem we see in people that are hypothyroid. Inability to focus and think clearly. Low body temperature, cold hands and cold feet. Inability to really sleep well. They get insomnia. They get joint and muscle aches and pains. They don't heal up well after they have an injury or a cut. They have stomach disorders. Commonly, it would be constipation. But it could be if they've had a lot of antibiotics due to a lot of infections because they have an altered immune system now because the immune system can't produce enough energy. Well, they may have yeast problems. They have bloating, building, and gas. That can be easily a problem. Women will have irregular menstrual cycles. Oftentimes, they'll have problems with fertility or carrying a baby to full term. They get bloating, belching, and gas, of course, intestinally, but they also get bloating in their face and their skin. Their tissues swell. They get a pasty look. They get dry skin. They get ridged fingernails, loss of the lateral third of the eyebrows, enlarged tongue. Generally, these people just don't feel well. So they go to the doctor and got all these problems, and the doctor goes, well, I guess you got chronic fatigue syndrome. We're going to put you on some, antidepressants. Well, folks, my belief is if anybody has the signs and symptoms of low thyroid, which chronic fatigue syndrome has all the signs and many of the signs and symptoms of low thyroid, you deserve a therapeutic trial of natural desiccated thyroid. It's how you do. You take it. If you get better as we increase the dose, that solves the problem. That's what you had, and we put you on that. We also check to see if you have antibodies to your thyroid gland, which is autoimmune thyroiditis, which few doctors check for because the insurance doesn't pay for it. We always check for that. We have in the last 31,000 guests we've had at the Hotze Health and Wellness Center. We always check to see if they have an inflammatory process, if they're making antibodies to their thyroid gland. So the long and the short of it is, don't let somebody slap a diagnosis of chronic fatigue syndrome on you and throw you on antidepressants. That will ruin your life, I promise you. It's not going to make you better. Nobody's sick because they have low levels of antidepressants or pharmaceutical drugs in your body. You have to get at the underlying problem, and commonly the underlying problem is low thyroid. It could also be adrenal fatigue. They go hand in hand. When a person's under chronic stress, they can stress out the adrenal glands, which sit on top of your kidneys about the size of a walnut. They produce adrenaline and cortisol, our fast-acting and long-acting stress hormones. And so sometimes the adrenal gland, due to chronic stress, chronic pain, chronic infections, can cause those can cause the adrenal glands to become fatigued, and they don't produce the natural hormone cortisol, which can adversely affect the ability to utilize thyroid hormones. So they tend to run hand in hand, adrenal fatigue and a low thyroid situation. They can be easily corrected naturally. So my recommendation to you, if you have these symptoms, just give us a call.
Absolutely.
Come in and get a health coach. Get somebody who's going to coach you on a path of health and wellness naturally.
Absolutely. And just a really short story to add on to that. I remember years ago, I was sitting in on a board meeting, and one woman had to leave just in the middle of the board meeting. It's kind of like, what's going on? What's wrong with her? And someone said, oh, she has chronic fatigue syndrome. It was kind of like, oh, like it's this very serious diagnosis. And there's something about calling something a diagnosis that there's no room for a conversation after that. It's like, oh, this is just what you have. Well, that's not what you have. It's like Dr. Hotze said, you have symptoms. That is not a diagnosis. And there is a natural way to be treated. So just give us a call. Everyone needs a health coach, 281-698-8698. That's 281-698-8698. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.